Hi, my name is Jessica. I'm one of the diabetes specialist nurses for the Aintree site. This is a demonstration video on how to administer insulin safely to your patients on the ward. So, firstly, we want to identify the correct type of needle. If you're administering insulin to a patient as a third party, safety needles must always be used. Now, on the Aintree site, we use a slightly different safety needle to the Royal and Broad Green site. However, the principles of use are the exact same for them all. On the Aintree site, we use these click start safety needles, and on the Royal site and the Broad Green site, you use micro dot needles. So what you want to do is obviously get your insulin and ensure obviously you're following the correct meds management policy, and it's the right patient, the right time, the right medication, the right route. And make sure obviously you've checked their allergies. So what I would want to do is apply the needle. So if I just come closer, you peel off the lid and you just screw it on to the end of the pen as such. So you can see that's now attached, and what I want to do is remove this clear cap. Now you can see that the needle is not exposed at that point, it's completely covered up, but you can see it through the blue cap. So I want to make sure that the needle is attached to the pen correctly. So I'm just going to dial up a couple of units and do what we call an air shot. So I could see that that has come out, so I know that when I administer the dose to the patient, they are going to get the full dose because it's connected correctly. So if my patient was on 10 units, what I want to do is dial up to the number 10 as shown. Now the correct injection sites are the stomach, the legs and the underarm. So you want to be injecting into the subcutaneous layer of fat, and when you inject you want to be rotating around to different sites to avoid any build-up of insulin or any pockets causing any lumps or bumps. So on here I'll use a demonstration stomach. So you want to be injecting onto bare skin. You don't need to clean it before. The patient should be suitably clean, and what you want to do is be feeling for the area first to make sure there is no lumps and bumps, deciding that that's the area you want to inject into. And then what you want to do is go in at a 90-degree angle as shown and just go directly into the skin and make sure it punctures, and then all you do is gently press down on the insulin pen until it goes back down to 0. Once it's back down at 0, you count to 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And what you want to then do is release the needle away from the skin. So you can see now on this safety needle that there's a cover come over the needle, and this cover is red, and that will stop any sharp injuries. And then what you can do is remove the needle off the pen as such and pop it straight into your sharps bit. You never need to worry that the patient's not received the full dose of insulin. You would see a large volume of liquid come out if they'd not received it. It's perfectly normal to see a small dot of liquid next to the injection site, as with any injection. It is also normal sometimes to get a small bruise or a little dot of blood. That might just be if you've hit a little blood vessel. It shouldn't cause any trouble to the patients and should go within a few days. Now, patients should not use safety needles. It's really important because they might not have the correct technique, they might not apply the right pressure, which means they might not be getting the insulin as is prescribed with the doses as is prescribed. If patients are able to, they need to fill out the correct self-medication forms on the ward and be assessed as competent, and then what they can do is administer their own insulin. So these would be the types of needles that the patients would use if they were going to administer it themselves. So you can see it looks very similar. You peel off your cap as such, screw it on to the end of the pen until it's locked in position, take off your first cap and then your second cap, and obviously you can see there this tiny little needle, and obviously that's an exposed needle, which is why as a healthcare professional we would never want to use that, as there's very high risk of sharps to us. But if patients were using it themselves, that's perfectly safe. So the same technique where they would dial up a couple of units, do an air shot, you can see that the liquid has come out there, so then they would dial up to their correct dose. So they're going to be on 10 units as well. And what they would do is inject again, the exact same injection technique, 90-degree angle onto clean skin in the correct site. And you just go directly in and press it down until it goes back down to 0 as shown. Then count to 10, 3, 4, 5, 6, 7, 8, 9, 10. We would remove it. As you can see, that needle is still exposed as it's a non-safety needle. So then what the patients will need is their own little sharp spoon, which should be at the end of their beds or available to them when they're administering. They can apply the cap back on and screw it off of the pen and dispose of it as such in their sharp spoon. If you ever have any worries or questions or concerns in regarding administering insulin, please always speak to your diabetes teams on the appropriate site. Thank you.